Nagaland reported its first cases of COVID-19. 3 persons, including 2 men and 1 woman who returned from Chennai in Tamil Nadu, have tested positive for novel coronavirus. While 2 are showing mild symptoms, 1 is said to be asymptomatic. The samples were tested at the newly inaugurated BSL-3 laboratory at Kohima. Until this case, Nagaland was the only Indian state to have not reported a single case of the highly contagious coronavirus disease, which has now spread across the length and breadth of the country and in most parts of the world. Earlier, Nagaland has not counted the patient who tested positive in Assam after being transferred by the Dimapur hospital. In Zan's report. Nagaland reported its first cases of COVID-19 on Monday morning, May 25. 3 persons, including 2 men and 1 woman who returned from Chennai in Tamil Nadu, have tested positive for the novel coronavirus disease in the state. Nagaland Principal Health Secretary Manukal John made the announcement on Monday at a press conference at Kohima. While 2 are showing mild symptoms, 1 is said to be asymptomatic. The samples were tested at the BSL-3 lab in Kohima and the results came out early on Monday morning, John said.
Nagaland is no longer green. We already have 3 positive cases as of now. Our medical team, they're trying the best that we can. And we have information that yes, 2 of them are symptomatic, 1 is asymptomatic. But all the same, we're going for an aggressive surveillance as well as treatment protocols and how to take care of them.
The patients were part of the first special train which was arranged by the Nagaland state government to evacuate stranded students from Chennai. The train had reached Dimapur station around 6:20 p.m. on Friday. The Principal Health Secretary also urged the citizens of Nagaland not to stigmatize the patients.
Our appeal from the Department of Health and Family Welfare is that do not stigmatize our patients and also be supportive about the health workers who will be looking after them. And these cases are not local. It has been imported from travelers who has come back home. Be with us in this fight against COVID. We're trying the best that we can, but we need all support from everybody.
Meanwhile, contact tracing of those tested positive have already started and the state government is taking adequate steps to counsel the patients. The primary contacts will be tested and isolated, said official. Health Minister S. Pangyu Pom said that while 2 patients are undergoing treatment at District Hospital Dimapur, the 3rd is at Chedama COVID-19 Hospital in Kohima. Chief Secretary Temjon Troy, also addressing the media person on Monday, said that the real challenge has now started. However, he and the Principal Health Secretary Manukal John have appealed people not to panic and to respect the privacy of all those who have tested positive for the novel coronavirus.
The real challenge starts. This is the time for the people of Nagaland to rise up and show our goodness, our cooperation, to set as an example. When the first case came out, you know the kind of reactions that happened, stigmatization that happened, and then the entire social media went berserk. I wish that this does not happen. We have taken adequate care to counsel those who have been tested positive.
Temjon Troy said that with the arrival of the stranded person from outside the state, the government along with the district administration and frontline workers have been stepping up its preventive measures with great efficiency. With many more stranded scheduled to arrive Dimapur, he said that as the BSL lab at Kohima had started functioning and therefore all the returnees sample will be tested within their quarantine period.
People in the health department, they have started following whatever protocol has to be followed. Starting with treatment, contact tracing, and also increasing number of tests that need to be conducted. The testing, all persons coming in will be tested, and that is going on.
Further, he also appealed to the citizens not to panic of the situation but to take necessary precautionary measures at the individual level, which is one of the most important steps.
This is not much to worry about. This is the time actually for all of us to rise and show our solidarity, our determination to fight this pandemic together. The pandemic is here to stay and we have to live with it. And our initial reaction on how we react is going to go a long way in our addressing this disease.
He said COVID-19 is here to stay, so we have to learn how to live with it by taking precautionary measures. Earlier, one person from Nagaland's commercial town Dimapur tested COVID-19 positive after he came to Guwahati Medical College Hospital for test and treatment. Nagaland government did not count him in the state's tally, while Sikkim reported its first case on May 23rd, returnees from Delhi. With Inzan Bimukhovo, Kohima.